Then Ashton is here answering one of your medical questions. Here it is. How does the location of my uterine fibroid impact my symptoms and treatment options? That's from Sarah Kay.
I could talk about this for hours. And by the way, 80% of women have fibroids. These are benign tumors in the muscle in the uterus. Just like the saying goes in real estate, in fibroids, location, location, location. Not all fibroids require treatment, and not all fibroids produce symptoms. So you want to ask, if you're told you have fibroids, you want to ask, where are they located? Are they inside the uterine cavity like an avocado pit, or are they outside? The ones that are outside can get really large, but they're not probably going to give you significant symptoms. And you want to ask the size and where in the uterus that it's located. So a tiny 1 centimeter fibroid most likely will not require any treatment. If the fibroid grows to this size, that's going to give you some symptoms and require treatment. And then in terms of the treatment, there are hormonal treatments, there are surgical treatments, and there's a non-surgical option that a lot of gynecologists unfortunately don't talk to their patients about, which is embolization, done by interventional radiologists. So I have a whole section on fibroids in my magazine, but it's so common, more common with Black women as well.
Make sure you pick up a copy there. What's your prescription for wellness?
Okay, has to do with sunscreen, the basics, because we are obviously in the season, but some people in parts of the country are in that season of sunscreen every single day, and I would argue that should be anyone, regardless of where they live. You want to look for a sunscreen with an SPF of 30, broad spectrum, at least 30. If you want to go higher, that's fine as well. You want to apply 15 minutes before going outside. We put our sunscreen on every single morning before we leave, right, DeMarco?
Yes, ma'am.
And you want to use enough. This is the biggest mistake that people make. They don't use enough. You want to fill a shot glass. That's basically 1 ounce for your entire body, and then reapply every 2 hours. I actually keep some sunscreen in my handbag, and I use it on my face, neck, and hands multiple times a day.
Same.
It may be too late for me, but it's not too late for a lot of people. And again, regardless of your skin color.
That
really
reapply every 2 hours is so
correct.
important, because a lot of people don't put it on in the mornings and then they're like,
and
we're
it's
good.
easy to forget, but we need it.
All right, we're listening. Thank you very much. And folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions for Dr. Jane at ABC GMA3.